Hello and welcome to this video about 3D and 4D ultrasound. Let's start with an overview of the fascinating topic we'll be exploring today. In this video we'll dive into the world of volume acquisition systems and how they enhance ultrasound imaging. From understanding the mechanics of 3D and 4D imaging to practical tips for obtaining the best sonograms, this guide is designed for both beginners and experienced practitioners. Let's start by defining and explaining 3D acquisition. Volume acquisition systems today primarily use mechanically moved transducers. These transducers come in various types such as linear, convex, or transvaginal. The probe itself includes a mechanical movement system, which is essential for acquiring detailed images and volumes. This technology forms the foundation of 3D ultrasound imaging. The information obtained through 3D volume acquisition is vastly superior to a video or Cine loop of 2D information. It provides a more comprehensive and detailed view of the anatomy, enhancing diagnostic accuracy and visualization. On reaching the ROI, the operator must keep the transducer stable while the patient stays still, so that the probe may scan simultaneously. Images are then captured and processed by a computer that will display them three-dimensionally. In the multiplanar volume mode, 3 planes are shown, longitudinal or sagittal in the A plane, transverse in the B plane, and coronal in the C plane. And an orthogonal reconstruction is obtained, which may be rotated around 3 axes, X, Y, and Z, for better evaluation of the included and targeted anatomy. Real-time 4D imaging takes the concept of 3D ultrasound a step further by providing continuous, dynamic imaging. It allows for the simultaneous visualization of the A plane, B plane, and C planes, which are critical for viewing different perspectives of the scanned area. This real-time capability is made possible by the advanced technology in 3D and 4D transducers, which are designed to sweep and automatically acquire volume data. These transducers capture up to 20 volumes per second, ensuring that the 3D image is constantly updated and providing a live 3D view. This continuous flow of data enables real-time observations and is crucial for visualizing complex fetal structures or dynamic movements during an ultrasound examination. Now, let's explore some important factors that influence the quality and efficiency of real-time 4D imaging. One of the key advantages of 4D imaging is the automatic movement of the ultrasound beam over the region of interest. This automation ensures that the scanning process is both precise and efficient, reducing the need for constant manual adjustments during the scan. The volume box plays a crucial role in determining which structures will be included in the 3D reconstruction. If certain structures fall outside the volume box, they will be excluded from the final 3D image. This gives the operator the flexibility to focus on specific anatomical areas without unwanted noise from outside regions. Another important feature is the operator's ability to control the scanning speed. Slower scanning speeds can enhance the resolution of the final image because it maximizes the number of 2D slices captured within the volume. However, this may increase the total scan time. The size of the volume box also impacts the acquisition time and image quality. A larger volume box requires more time to scan and capture data, resulting in a slower volume rate, fewer volumes per second. This trade-off can affect the speed of the scan but may be necessary for obtaining a broader and more detailed 3D reconstruction. Let's dive deeper into some of the fundamental concepts behind 4D imaging, focusing on pixels, voxels, and volume rendering. In traditional 2D imaging, a pixel is the smallest unit of the image, essentially representing one point of data. However, in 3D and 4D imaging we work with voxels. A voxel is a 3D pixel, or the smallest unit of information in a 3D volume, containing detailed data about a small portion of the scanned area. Volume rendering is the process by which 3D voxel data is visualized on a 2D screen. This technique takes the voxel-based images captured by the ultrasound system and displays them in a way that simulates a 3D structure. One of the key benefits of modern ultrasound technology is fast volume data processing. This allows the ultrasound system to capture and display multiple volumes per second. Depending on the system hardware and the size of the rendering box, modern systems can process anywhere from 1 to 20 volumes per second. This speed is crucial for maintaining a smooth, continuous image and ensures the system is capable of capturing fast-moving structures, such as a beating fetal heart. Although 4D imaging is often described as real-time, it's important to note that there is always a slight delay. This delay is caused by the time required to reconstruct the 3D image from multiple 2D slices. While advancements in technology have minimized this delay, it's still a factor to consider, especially when trying to visualize dynamic movements or structures in motion. When it comes to 4D imaging, achieving the highest volume rate, the number of volumes per second, is desirable to ensure smooth and continuous imaging. However, there is a trade-off between image quality and volume rate. Higher volume rates may result in lower resolution, as fewer details can be captured per second. On the other hand, a higher image resolution typically results in a lower volume rate, meaning that the scan process takes longer. Understanding this balance is key to optimizing 4D imaging for clinical use. In conclusion, while 4D imaging offers remarkable advancements in ultrasound technology, balancing the speed, image quality, and resolution is crucial for obtaining the best diagnostic results. The ability to manipulate the volume rate, control the rendering process, and manage the quality of the image makes real-time 4D imaging a powerful tool for visualizing and assessing complex anatomical structures. Achieving high-quality 3D and 4D imaging begins with ensuring that the 2D images are optimized. Since 3D and 4D reconstructions rely heavily on the initial 2D data, it's crucial to take the time to adjust settings and parameters to ensure the best possible image quality before beginning volume acquisition. To achieve that, make sure the depth is properly set. This ensures the region of interest is captured clearly with good resolution. The focus position is equally important. Setting the focus at the correct depth guarantees that the structures you're interested in will appear sharp and well-defined. In some cases, it may be necessary to use multiple focuses to capture fine details at different depths. Frequency plays a significant role in optimizing image quality. Higher frequencies offer better resolution but shallower penetration, while lower frequencies provide better depth but with reduced resolution. Finding the right balance between these is crucial for visualizing deeper structures while maintaining clarity. Adjusting the gain is another vital step. The gain controls the overall brightness and contrast of the image, enhancing subtle structures that may otherwise be hard to detect. Proper gain settings ensure that the image is neither too dark nor overly bright, maintaining adequate contrast for easy interpretation. When working with color Doppler imaging and power Doppler imaging, additional adjustments must be made to capture blood flow or moving structures. First, adjust the velocity to match the expected range of blood flow velocities. This setting allows the Doppler shift to be captured accurately, ensuring that vascular structures are clearly visualized. The wall filter is another key adjustment in Doppler imaging. By filtering out unwanted signals from the vessel walls, the wall filter enhances the clarity of the Doppler signal, making it easier to assess blood flow within vessels. Persistence is a feature that can help reduce noise in the image by averaging frames over time, smoothing out the image and providing a clearer picture of the anatomy. Lastly, adjusting the Doppler gain ensures that the strength of the Doppler signal is adequate, which is crucial for visualizing blood flow, heart movements, and other dynamic structures. By ensuring that these settings are correctly adjusted, you'll lay the foundation for high-quality 3D and 4D imaging. These settings not only improve the quality of the images but also enhance the diagnostic accuracy, making it easier to evaluate complex fetal structures, blood flow, and other anatomical details. Now that we've covered the key settings to optimize 2D image quality, let's dive into some additional factors that can impact the quality of 3D and 4D imaging. Anechoic regions such as cysts or amniotic fluid can sometimes be difficult to visualize clearly because they don't reflect sound waves as strongly as surrounding tissues. To improve the visualization of these regions, adjustments to the gain are necessary. Increasing the gain can enhance the contrast between anechoic areas and surrounding structures. Additionally, special attention must be given to potential artifacts, such as speckle noise or shadowing. These can arise from tissue or movement and can degrade the quality of the image. Using the correct filters and ensuring the transducer is properly positioned can minimize these artifacts and help you capture clearer, more accurate images. Patient positioning is critical for achieving optimal results, especially when performing detailed scans like fetal imaging. Ensuring the patient is in the correct position can make a significant difference in the quality of the scan. This may involve adjusting the head, torso, or limbs depending on the anatomical area of interest. Additionally, ensuring that the abdomen is properly prepared is equally important. Adequate application of gel and ensuring the transducer is in direct contact with the skin eliminates any air pockets and improves the transmission of sound waves, further enhancing image quality. By taking into account these additional factors, such as adjusting for anechoic regions, minimizing artifacts and preparing the patient properly, you can significantly improve the quality and accuracy of your 3D and 4D ultrasound images, ensuring the most precise and detailed results for clinical use. The region of interest is a critical feature in 3D and 4D imaging, allowing the operator to customize the scan to focus on specific areas of interest. The first adjustment available is size. The ROI can be resized to either zoom in on a smaller area for higher detail or expand it to cover a larger portion of the anatomy. This gives the operator complete control over what is included in the scan, allowing for optimal focus on areas that are clinically relevant. The ROI is also movable across the scanning field. This flexibility enables the operator to adjust the ROI to the exact region they want to image, ensuring that the area of interest is properly centered and aligned for scanning. Movement can be done in all directions to capture the most accurate and comprehensive image. In addition to resizing and moving, the ROI can also be rotated in three-dimensional space, allowing the operator to change its angle along the X, Y, and Z axis. This rotation capability is essential when working with complex anatomical structures, as it provides the ability to view the region from different angles, ensuring that no critical details are missed. By adjusting the ROI in these three ways, resizing, moving, and rotating, the operator can ensure that the image captures the necessary anatomy from the best possible perspective, enhancing both the detail and diagnostic value of the scan. Now, let's look at the different rendering modalities available in 3D and 4D ultrasound. Each rendering mode provides a specific way of visualizing anatomical structures, and selecting the appropriate one depends on the clinical needs and the tissues being assessed. First mode is the minimum mode. In minimum mode, the lowest intensity values in the volume are shown, making it ideal for visualizing soft tissue structures. This is particularly useful when evaluating organs or tissues that have varying echogenicity, such as the fetal brain, where differentiation between various tissue types is essential for proper diagnosis. On the other hand, maximum mode is excellent for visualizing bone structures. By displaying the highest intensity values, this mode ensures that denser structures like bones are highly visible. It's ideal for assessing the skeletal system and identifying any skeletal abnormalities, such as bone fractures or developmental issues. For assessing surface anomalies or the external contours of structures, surface mode is used. This rendering mode applies gradient lighting to enhance the visibility of surface features by simulating the way light interacts with the object, creating shadows and highlights that emphasize surface abnormalities. This is particularly useful when visualizing the fetal face or fetal heart, where surface anomalies may indicate underlying conditions. Finally, X-ray mode offers a unique capability to visualize both bones and soft tissue in the same image. By combining information from both types of tissues, this mode provides a comprehensive view of the anatomical structures. The X-ray-like appearance helps distinguish between hard, dense bones and softer tissues, making it easier to evaluate their relationship and detect abnormalities or developmental issues. By selecting the appropriate rendering modality, the clinician can tailor the imaging to the specific needs of the case, ensuring the most accurate and informative visualization possible. Now let's explore how vascular structures are displayed in 3D and 4D imaging. One method of visualizing vascular structures is by creating 3D volumes based on 2D grayscale images combined with color Doppler imaging or power Doppler imaging modes. These Doppler techniques enhance the 3D volume by highlighting the flow of blood within vessels, allowing clinicians to assess vascular features, detect abnormalities, and visualize blood flow in greater detail. Another powerful tool for visualizing vascular structures is B-flow mode. Unlike conventional Doppler techniques that use color to map blood flow, B-flow enables direct imaging of the blood flow itself. This mode provides an exceptional view of vessel walls and flow patterns, without the typical color mapping artifacts. It is especially useful when examining fetal blood vessels, where clear and detailed visualization of the circulatory system is critical for detecting any irregularities or issues. The glass body mode is particularly useful when you need to visualize vascular structures alongside surrounding tissue. The transparency of the surrounding tissues in this mode enables a clearer view of the vascular structures, helping to assess them in relation to other anatomical features. This mode offers the advantage of viewing the vessels without the interference of surrounding structures, allowing for a focused examination of blood flow and vascular development. With these modes, 3D volumes with color Doppler imaging and power Doppler imaging, B-flow, and glass body, clinicians can obtain detailed, comprehensive views of vascular structures, aiding in the diagnosis of vascular abnormalities and the evaluation of blood flow dynamics. Now, let's focus on surface rendering, which is a powerful technique for visualizing external anatomical features and surface anomalies in 3D and 4D imaging. In surface rendering mode, only the signals from the surface of the region of interest are processed and displayed. This results in a plastic-like appearance of the anatomical structures, making it easier to visualize the external contours and features of the body. The emphasis on surface anatomy is particularly useful for detecting external defects or deformities. When applied to fetal imaging, surface rendering focuses solely on the external surface anatomy of the fetus. This is ideal for examining facial features, limbs, and body contours, providing a clear and detailed view of the fetus' external appearance. It allows clinicians to assess the overall development and look for any external anomalies. One of the main advantages of surface rendering is its ability to highlight surface anomalies such as encephalocele, spina bifida, cleft lip and palate, and abdominal wall or limb defects. These conditions are often visible at the surface and can be effectively detected using this mode, which brings attention to the external features that are most indicative of these anomalies. Surface rendering provides optimal results when the anatomical structures of interest are surrounded by fluid or hypoechoic tissue. This enhances the contrast between the surface anatomy and the surrounding areas, making the outer features more visible and distinct. In fetal imaging, this is particularly useful as the fetus is typically surrounded by amniotic fluid, providing a clear delineation of the surface anatomy. By using surface rendering, clinicians can obtain a high-quality visualization of the fetal external anatomy, allowing for the detection of surface anomalies and providing critical information for diagnosis and treatment planning. Let's delve deeper into how surface rendering can be fine-tuned for optimal results. In surface rendering mode, the quality of the reconstructed image can be controlled by adjusting the threshold parameter. Voxels with grayscale values below a selected threshold are excluded from the image, meaning that the operator can limit the visualization to the most relevant structures. This threshold adjustment allows for clearer surface renderings and helps to highlight only the structures that are critical for diagnosis. Surface images can be displayed in the textural mode, which adds texture to the surface, providing more detailed representations of the anatomy. This mode can be smoothed, helping to create more realistic, continuous structures that appear natural on the screen. This is especially useful for visualizing soft tissues, where smooth transitions between surfaces are important. Surface images can be displayed in the textural mode, which adds texture to the surface, providing more detailed representations of the anatomy. This mode can be smoothed, helping to create more realistic, continuous structures that appear natural on the screen. This is especially useful for visualizing soft tissues, where smooth transitions between surfaces are important. The textural and smooth surface displays are particularly effective for imaging fetal facial features, the abdominal wall, genitals, the umbilical cord, and urinary bladder surfaces. These displays enhance the clarity of the external anatomy, enabling clinicians to assess for surface anomalies such as cleft lip, spina bifida, or other developmental concerns. Another powerful feature of surface rendering is the ability to replace grayscale values with different colors or tints. This allows the operator to highlight specific structures, improving visualization and enhancing contrast. By coloring certain areas, the clinician can emphasize particular features or differentiate between tissue types, improving diagnostic accuracy. Surface rendering also allows for different lighting modes, which can significantly enhance the 3D visualization of the anatomy. As we discussed earlier, the threshold parameter determines which structures are visualized in the surface rendering. By excluding voxels with grayscale values below the set threshold, the clinician can highlight the most relevant anatomical features and improve the overall clarity of the image. The ability to apply colors or tints to the surface rendering allows for enhanced contrast and better differentiation between tissues or structures, helping to improve diagnostic accuracy. In light mode, closer structures appear brighter while those farther away are displayed darker. This gives the surface anatomy a more dynamic and layered appearance, helping to provide a clear sense of depth and distinction between structures in the 3D space. For even more realism, gradient light mode simulates virtual lighting from a spotlight source, providing more natural illumination of the fetal anatomy. This mode adds a sophisticated level of depth and emphasis on surface contours, helping to bring out the details in the fetus' external features. It's especially useful when examining areas that require accurate representation of light and shadow. By adjusting the threshold, selecting the textural or smooth surface display, and utilizing the light and gradient light modes, clinicians can enhance the surface rendering to create the most accurate, detailed, and diagnostic images possible. Now, let's look at transparent mode, which is designed to highlight the internal structures of the region of interest by extracting signals from deeper within the volume. Unlike surface rendering, transparent mode focuses on the internal layers of the anatomy. This mode is excellent for creating spatial reconstructions of internal structures, helping clinicians visualize what lies beneath the surface. In transparent mode there are two submodes. The maximum mode extracts signals with the highest echogenicity, ideal for highlighting denser structures like bones. The minimum mode extracts signals with the lowest echogenicity, which is useful for visualizing softer tissues, such as fluid-filled structures or areas with less density. Transparent mode is particularly useful for imaging fetal bones, the endometrium, and the breast, as it provides clear visibility of structures with varying echogenicity. The ability to visualize both dense and soft tissues makes it a powerful tool for assessing internal anatomy. By adjusting the various rendering modes, including surface rendering, light modes, and transparent rendering, operators can obtain a comprehensive view of both external and internal structures, improving diagnostic accuracy and providing detailed insights into the anatomy. Now let's explore maximum mode, a modality that is specifically designed for visualizing bone structures within the volume. In maximum mode, only the maximum gray values of the volume are displayed, highlighting denser structures like bones. This mode is highly effective for imaging skeletal structures, where higher echogenicity is typically present. That makes it the mode of choice for visualizing fetal bones as it provides spatial relationships between bones. One of the significant advantages of maximum mode is the ability to visualize curved bones, such as the ribs, mandible, and clavicle, in a single image. This provides a comprehensive view of these structures, which can be difficult to capture accurately in 2D sonography due to their natural curvature. Evaluating the fetal skeleton, particularly the thoracic skeleton, can be challenging in 2D imaging because of the curved nature of bones like the ribs and clavicles. Maximum mode overcomes this limitation, providing a clearer view of these bones and their spatial relationships, making it easier to assess skeletal development in developing fetuses. By using maximum mode, clinicians gain better insights into bone development and can more accurately assess the overall skeletal structure of the fetus, including the curvature of bones and their positioning relative to each other. Let's delve deeper into maximum mode and its advantages for imaging bone structures and curved anatomy. In maximum mode, only the maximum gray values of the volume are displayed, emphasizing the denser structures like bones. This mode is essential for clear bone imaging, as it enhances visibility by reducing the interference from surrounding tissues. An important feature of maximum mode is its ability to reduce the echogenicity of soft tissues that lie behind denser structures like bones. This ensures that bones are more clearly visible, without the masking effects of overlying soft tissue echogenicity. In maximum mode, curved bones like the ribs, mandible, and clavicle can be visualized in their entirety in a single image, which is often difficult to achieve with 2D sonography due to their curvature. This feature improves visualization of skeletal development in fetal imaging. Evaluating the fetal skeleton, particularly the thoracic skeleton, can be challenging with 2D sonography, especially when dealing with the curvature of bones. Maximum mode addresses this challenge by providing a clearer, more complete view of the spatial relationships between bones, aiding in the assessment of skeletal development. In 3D sonography, ribs can be fully visualized using transparent mode, and the vertebral column can be examined for both anteroposterior and lateral curvatures. This is essential for a more accurate representation of the spine and rib cage in the developing fetus. The combination of 3D surface and transparent modes enhances the ability to detect congenital malformations of the fetal spine, such as scoliosis or spina bifida. These modes offer better visualization of spinal deformities, improving diagnostic accuracy and enabling early intervention. The electronic scalpel is an important tool in 3D sonography that enhances the clarity and accuracy of imaging by removing unwanted structures from the visualization. In fetal imaging, overlying and adjacent structures like the umbilical cord, placenta, and fetal limbs can obscure the fetal anatomy and hinder the clinician's ability to accurately assess the fetus. These structures need to be removed or minimized in order to improve the visualization of the target area. The electronic scalpel or MagiCut tool addresses this issue by allowing clinicians to remove overlying structures using 3D imaging technology. It enables the user to isolate the target anatomy with precision, making it easier to assess structures without interference from surrounding tissues. The electronic scalpel offers multidimensional cutting capabilities. It can remove unwanted structures in all three axes, X, Y, and Z, allowing for complete and accurate removal of interfering tissues. This gives clinicians better control over the image and ensures that the structure of interest is clearly visualized. The electronic scalpel is particularly valuable in imaging areas such as the fetal face, brain, heart, and limbs, where surrounding tissues often obstruct the view. By removing these obstructions, it is easier to obtain detailed, accurate images, enhancing both diagnostic accuracy and clinical decision-making. Now let's discuss artifacts in 4D ultrasound and how they can impact the quality of imaging. Several artifacts can appear during the acquisition and rendering of volumetric ultrasound images, affecting image clarity and diagnostic accuracy. These include acoustic shadowing, which occurs when sound waves are blocked by dense structures, leading to a shadow on the image. This can obscure important details behind dense tissues like bones. Acoustic enhancement, which happens when sound waves pass through hypoechoic or fluid-filled tissues, causing brighter areas to appear in the image. While this can be useful in certain circumstances, it can also create confusion if not properly interpreted. Reverberation, which causes multiple echoes and can result in false structures being displayed, making the image harder to interpret. Refraction, where the bending of sound waves causes distortion of the image, leading to inaccuracies in the depiction of structures. Motion artifacts, often caused by fetal movements, vascular pulsation, or even maternal movement, which can distort or blur the image, particularly in vascular imaging. In addition to these common artifacts, there are specific artifacts related to the volume acquisition process. Acquisition artifacts occur during the initial capture of volume data. Poor probe positioning or insufficient coverage of the region of interest can result in incomplete or distorted volumes, affecting the image quality. Rendering artifacts arise during the processing of the acquired data into 3D or 4D images. These artifacts can appear as distorted shapes, gaps, or missing data in the reconstructed volume, potentially hindering accurate interpretation. Processing artifacts occur during the final stage when the 3D or 4D image is constructed. These can include unrealistic textures, improper boundary delineation, or other anomalies in the image due to errors in the computational processing steps. To reduce the impact of these artifacts, it's crucial to adjust ultrasound settings such as depth, focus position, gain, and frequency to optimize image quality. Additionally, during the rendering and processing stages, advanced software tools and techniques can be used to minimize distortions and artifacts, ensuring clearer, more accurate volumetric reconstructions. The 3D and 4D Cine sequence is a powerful tool in ultrasound imaging that enhances both the review and post-processing stages of volumetric data. The 4D Cine loop allows examiners to review volumes and select the best demonstration of the region of interest. This is crucial for ensuring that the most informative and representative image is captured for storage or further processing. After capturing the volume, it can be stored in the ultrasound system's database for later processing. This enables additional adjustments such as reorientation, rendering, and other enhancements to create an accurate 3D or 4D reconstruction, enhancing the diagnostic value of the image. The 3D Cine mode enables rendering and animation of the volume data. The system allows for the rotation of the volume on screen in multiple directions, offering dynamic views of the region of interest. This capability aids in better understanding and interpretation of the scanned area, especially in complex anatomical cases. After processing, the 3D animation can be stored as an AVI or MP4 video file or as an image in common formats like JPG and bitmap. This makes it easier to share with colleagues or archive for future reference, supporting collaboration and ensuring the availability of high-quality images for clinical or educational purposes. In this section, we'll look at a variety of special volume imaging modalities that enhance the capabilities of 3D and 4D ultrasound. These advanced imaging techniques provide clinicians with more detailed, accurate, and comprehensive views of fetal structures and their surrounding tissues. STIC is a dynamic imaging technique that correlates 2D images over time to create a 3D reconstruction. This is particularly valuable in observing complex fetal movements and analyzing the fetal heart and circulatory system in motion. It helps produce time-synchronized images, allowing for a clearer understanding of dynamic anatomical features. Inversion mode enhances image visualization by inverting the grayscale, offering a greater contrast between tissues of varying echogenicity. This technique is especially useful for highlighting subtle anatomical features that might be harder to detect in standard imaging modes. VCI, also known as OmniView, is an imaging modality that improves tissue contrast in 3D volumes. It is particularly beneficial for visualizing soft tissues or vascular structures in a more defined and detailed manner, enhancing diagnostic accuracy. TUI creates a series of 2D slices from a 3D volume, enabling the examiner to focus on specific planes of interest. This allows for detailed views of the fetal anatomy at different depths and angles, improving the assessment of complex anatomical structures and abnormalities. B-flow is a special Doppler modality that enhances the visualization of blood flow without the usual Doppler color. This technique provides a clearer view of vascular structures and can be particularly useful for assessing the blood flow in critical areas like the fetal brain, heart, and umbilical cord. Voxel is a tool used for the quantitative measurement of volumes in 3D and 4D ultrasound. It allows for precise measurement of fetal organs, amniotic fluid, and other structures. This method provides valuable objective data that can aid in clinical decision-making, offering a better understanding of the fetal growth and development. Spatiotemporal image correlation is an advanced volume ultrasound technique that significantly enhances the ability to assess dynamic fetal structures. The STIC technique operates by capturing a sequence of 3D images that are analyzed in both the spatial and temporal domains. This allows for a highly detailed and time-synchronized evaluation of fetal anatomy. STIC begins by performing an automatic volume sweep. This sweep captures a dynamic sequence of 3D images, which is then processed to create a time-synchronized 3D reconstruction. The resulting sequence allows for the visualization of dynamic structures such as the fetal heart in various stages of the cardiac cycle. The most common application of STIC is the assessment of the fetal heart. The 4D cardiac images produced by this technique can be displayed in a multiplanar reformatted cross-sectional view, allowing the clinician to observe the heart from different anatomical planes, such as the 4-chamber and 5-chamber views. This comprehensive approach aids in detecting abnormalities and ensuring that the heart is developing correctly. Surface rendering allows for a 3D surface view of the heart and other surrounding structures. This mode creates a more intuitive visualization that shows the fetus and its organs in 3D, which is especially useful when assessing the overall shape and position of the heart. STIC is widely used for evaluating fetal cardiac abnormalities, as it provides a detailed and dynamic view of the heart's structure and function. This technique helps detect congenital heart defects, arrhythmias, and other cardiovascular issues in the fetus. Additionally, STIC is beneficial for assessing the function of the heart as it moves through the cardiac cycle, providing valuable diagnostic information. STIC has the ability to capture a dynamic 3D reconstruction of the heart. Multiplanar imaging that provides a comprehensive view of fetal anatomy. Surface-rendered views that offer a clearer understanding of complex structures. Temporal correlation that enables the assessment of heart movement and function. Inversion mode is an innovative rendering algorithm that significantly improves the visualization of fluid-filled anatomical structures in 3D and 4D ultrasound. The technique works by transforming anechoic structures, which are typically dark and grayscale images, into solid voxels, allowing for clearer and more detailed images. In inversion mode, structures filled with fluid, such as the heart chambers, great vessels, and bladder, are represented as solid or more echogenic voxels. This makes it easier to distinguish these structures in the rendered 3D image. Structures that were previously echogenic, like bones or soft tissues, will now appear anechoic, effectively reversing the typical grayscale presentation. It enhances the visualization of fluid-filled spaces, making them stand out more clearly. For instance, the heart chambers and great vessels become more distinct, which helps clinicians evaluate their size, shape, and relationship to surrounding structures. This is especially useful when assessing the anatomy of the fetal heart or evaluating fluid-filled spaces within other organs. Inversion mode is particularly beneficial in imaging the fetal heart, where it allows for a more accurate depiction of the heart chambers and great vessels. It also improves the visualization of fluid-filled structures such as the bladder in fetal imaging or vascular structures in vascular studies. To summarize benefits, inversion mode provides a clearer representation of fluid-filled anatomical structures, such as heart chambers and great vessels. It enhances contrast between fluid-filled spaces and surrounding tissues. Offers improved diagnostic clarity for evaluating pathologies related to fluid-filled spaces. Volume contrast imaging, or VCI, also known as OmniView, is a real-time volume rendering technique that enhances traditional 2D ultrasound by adding 3D/4D visualization. VCI operates by selecting thick slices of tissue data, with slice thicknesses that can be adjusted between 3 and 20 millimeters. This flexibility allows clinicians to focus on specific regions of interest with varying levels of detail. VCI is a real-time technique, meaning that the images are generated on the spot, without the need for post-processing. This real-time capability allows the sonographer to assess and adjust the image immediately, facilitating quicker decision-making during the exam. A standout feature of VCI is its ability to provide both conventional 2D ultrasound images and volume-rendered 3D and 4D images at the same time. This combination allows the operator to correlate the traditional 2D views with the enhanced 3D and 4D renderings, providing a more comprehensive understanding of the region of interest. The volume-rendered image created by VCI combines surface rendering and transparent maximum mode. This dual approach helps visualize both the surface anatomy, such as the fetal face, limbs, or abdominal wall, and internal structures, such as organs or vascular systems, by emphasizing different aspects of the tissue. OmniView is widely used in a range of clinical applications, including fetal imaging, vascular imaging, and organ imaging. Its ability to render both external and internal anatomical structures in real time makes it particularly useful for assessing fetal development and detecting anomalies. To summarize benefits of virtual contrast imaging, it offers real-time imaging for immediate assessment. It provides simultaneous 2D and 3D or 4D images for better understanding of the anatomy. It allows for adjustable slice thickness to focus on areas of interest. And it also combines surface and transparent rendering for a comprehensive view of the anatomy. So again, volume contrast imaging is a powerful tool for improving the contrast resolution of tissue structures. By selecting thick slices, 3 to 20 millimeters, VCI enhances the clarity and differentiation between tissues that are difficult to distinguish in standard ultrasound imaging. It is a real-time technique that combines 2D conventional images and volume-rendered 3D and 4D images for a more comprehensive view. VCI offers a marked improvement in tissue contrast resolution, allowing for better visualization of structures with subtle differences in echogenicity. This is especially useful in clinical scenarios where conventional grayscale imaging may not provide sufficient detail. OmniView can apply it on the A-plane and C-plane. VCIA on the A-plane, and VCIC on the C-plane. VCIA reveals the same anatomical region as seen in traditional 2D ultrasound, but with enhanced contrast, allowing for better differentiation of structures in the image. VCIC provides a real-time coronal plane view of the ROI, offering a perspective that is difficult to achieve with conventional grayscale imaging. This is particularly useful for viewing anatomical structures that are hidden or not fully visible in traditional planes. OmniView is invaluable in fetal imaging, vascular studies, and organ evaluation. Its ability to improve tissue contrast and provide multiple viewing planes allows clinicians to make more informed diagnostic decisions. To summarize, OmniView provides real-time imaging of both surface and internal structures. It offers improved tissue contrast resolution, enhancing the visibility of anatomical details. It provides flexibility with VCIA and VCIC modes, enabling detailed views of the ROI from different angles. Tomographic ultrasound imaging, or TUI, offers a slice-based approach to 3D and 4D ultrasound imaging, making it easier to analyze structures layer by layer. By displaying up to 16 parallel slices of a volume dataset, TUI provides a detailed cross-sectional view similar to CT or MRI, but with the benefits of real-time ultrasound technology. TUI enables the simultaneous display of up to 16 slices from an ultrasound volume on a single screen. This provides a clearer and more detailed view of anatomical structures, enhancing diagnostic capabilities. Whether using static 3D datasets from previous scans or real-time 4D data for dynamic imaging, TUI accommodates both, allowing for versatile imaging during assessments. When combined with STIC, TUI is highly effective for fetal heart examinations. By displaying multiple slices of the heart in real time, it provides enhanced evaluation of fetal cardiac anatomy, assisting in the detection of congenital heart defects and structural anomalies. TUI, in combination with other imaging techniques such as power Doppler imaging, color Doppler imaging (VCI), and transparent volume techniques, is a valuable tool for visualizing pathological changes in abdominal organs and small parts. It allows for a multi-slice view of structures, providing enhanced diagnostic clarity in evaluating abnormalities such as tumors, malformations, and other pathological conditions. Clinical applications of TUI. In fetal heart imaging, TUI with STIC offers a detailed view of fetal heart anatomy, essential for detecting congenital heart defects. In abdominal and organ imaging, TUI is beneficial for assessing abdominal organs like the liver, kidneys, and stomach, identifying pathological changes such as malformations or tumors. In small parts imaging, TUI provides a comprehensive view of smaller anatomical structures, such as limbs or joints, where multi-slice imaging improves clarity and resolution. To summarize advantages of multi-slice imaging for detailed 3D and 4D analysis, it offers real-time and static imaging flexibility, enhanced clarity in examining fetal heart, abdominal organs, and small parts, improved accuracy in detecting structural anomalies and pathology. B-flow imaging is a powerful tool for fetal blood flow visualization, providing enhanced resolution and clear, grayscale images that help in the evaluation of peripheral blood vessels. Unlike Doppler imaging, B-flow allows for the direct visualization of blood reflectors without requiring adjustments for flow velocity or PRF, making it a simpler and faster option for clinicians. B-flow provides improved resolution with higher frame rates, resulting in clearer images and better visualization of blood flow compared to traditional methods. By directly visualizing the blood reflectors, B-flow allows for better detection of peripheral blood vessels, such as those in fetal limbs and placenta. This is especially beneficial when imaging smaller vessels that might be difficult to visualize with conventional Doppler imaging. With no need for adjustments like velocity, PRF, or flow settings, B-flow simplifies the imaging process. The clinician can quickly switch between conventional 2D imaging and B-flow imaging for both anatomical and blood flow assessments, increasing efficiency and speed during the examination. The ability of 3D sonography to obtain accurate volume measurements of irregular structures provides clinicians with an enhanced tool for diagnosis and monitoring. From fetal organs to pathological growths, the precision offered by 3D ultrasound allows for early intervention and more informed treatment plans, making it an invaluable technology in fetal medicine. Now let us advise you on how to achieve a good 3D image. The first and most crucial step to obtaining excellent 3D and 4D images begins with optimizing the 2D image. Before acquiring the volume for 3D imaging, it is essential to ensure that the 2D image has the best possible quality. The 2D base image serves as the foundation for accurate 3D reconstruction, so optimizing this image is vital. This step includes making adjustments to several parameters that directly affect image clarity and resolution. The gain setting controls the overall brightness of the image. A properly adjusted gain ensures that the anatomical structures are clearly visible, neither overexposed nor underexposed. An ideal gain setting enhances both the soft tissues and other structures of interest, making it easier to obtain precise 3D data. The TGC setting compensates for depth-dependent signal loss, ensuring that echoes from different depths are balanced. By adjusting the TGC, the user can avoid overly bright or dark areas in the image, enhancing uniformity and detail throughout the scan. It allows for consistent visualization of structures, particularly in areas where shadows or enhancement might otherwise obscure important features. Focus is critical for obtaining a sharp image. Setting the appropriate focus position ensures that the ultrasound beam is concentrated on the target anatomy. This improves resolution, especially in regions that are further from the probe, leading to better 2D images. Focusing correctly is also a key step before transitioning to 3D imaging, as the sharpness of the 2D image influences the quality of the 3D reconstruction. The image size should be adjusted to include the entire area of interest, ensuring that the anatomical structures are well within view. Setting the appropriate depth ensures that the ultrasound beam captures the entire volume of interest without unnecessary surrounding tissue that might distort the 3D reconstruction. A high-quality 2D image is essential for achieving accurate 3D and 4D reconstructions. Without a clear and well-optimized 2D image, the resulting 3D image will lack clarity and resolution. Even with the most advanced 3D technology, an excellent 2D base is necessary to produce usable 3D data. This highlights the importance of traditional ultrasound skills, as well as the need for advanced knowledge of the technical settings that affect 2D imaging. Once the 2D image is optimized, the next step is to become familiar with the new controls specific to 3D and 4D ultrasound imaging. While the 2D image optimization remains critical, sonographers must also master a range of new parameters such as volume acquisition settings, region of interest adjustments, and controls for volume rendering. Proper use of these controls ensures that the 3D image is well constructed and reflects the target anatomy accurately. For example, understanding how to adjust the sweep speed, volume box size, and slice thickness is crucial for controlling the quality and resolution of the 3D data. These new techniques build upon traditional ultrasound skills, but they also require new knowledge and practice to use effectively. In conclusion, the process of achieving a high-quality 3D image starts with optimizing the 2D image by adjusting key parameters such as gain, TGC, focus, and image size. Once the 2D image is optimized, mastering the 3D controls is essential for acquiring accurate volume data and producing detailed, realistic 3D images. By combining traditional 2D optimization skills with new 3D-specific controls, sonographers can produce the best possible 3D and 4D images, providing enhanced diagnostic capabilities and a clearer understanding of the anatomical structures being examined. Once the 2D image is optimized, the next critical step is the orientation of the 2D image. The sonographer must carefully select an optimal position, ensuring that the anatomy or structure of interest is well aligned and visible. Having a clear idea of the desired outcome for the 3D image is crucial at this stage. Proper orientation minimizes the need for corrections later and helps ensure a high-quality 3D reconstruction. After optimizing and orienting the 2D image, the next step is to activate the 3D or 4D mode. This involves acquiring volume datasets using specialized transducers designed specifically for volume scanning. The process begins with a standard 2D scan, where a volume box is superimposed over the region of interest. The 2D image presented on the screen acts as the central plane of the volume, forming the basis for the eventual 3D reconstruction. Properly setting up this step ensures accurate and comprehensive volume data acquisition. Adjust the region of interest. Once the 2D image is properly oriented and volume scanning is activated, the next crucial step is to adjust the ROI. The volume box serves as the boundary that frames the area to be imaged in 3D. Adjusting this box ensures that the target anatomical structure is fully captured in the scan. To fine-tune the ROI, the green line, representing the boundary of the volume box, needs to be carefully positioned. The green line can be adjusted in terms of position, shape, and rendering direction, allowing the sonographer to optimize the 3D reconstruction. This is critical for ensuring that only the relevant structures are captured and that the volume sweep accurately represents the region of interest. On the 2D screen, you will typically see two dimensions of the volume box, which helps in adjusting its size and positioning relative to the anatomy. The third dimension, depth or volume sweep, can be visualized as a small icon on the screen. This icon represents the volume angle, which indicates the scanning amplitude. By adjusting this, the sonographer can modify the extent of the scan, ensuring that the volume data includes all necessary structures. When imaging specific structures such as the fetal surface, it is important to ensure there is fluid in front of the target organ. The fluid helps in creating a better contrast for the 3D imaging process, enabling clearer visualization of the structure's external surface. On the other hand, when imaging more solid structures such as the fetal bony spine, fluid is of lesser importance. In this case, the bone's echogenicity provides adequate contrast for 3D reconstruction without requiring a fluid medium. Once all adjustments are made to the ROI and the 3D/4D mode is activated, the next step is to begin capturing the volume. Capturing the volume is done by pressing the Start key, which initiates the scan. The sweep time, the amount of time needed to capture the full volume, is dependent on two key factors: the size of the volume box and the scan quality settings that have been chosen. A larger volume box will require a longer sweep time, as more tissue data needs to be acquired. Similarly, higher scan quality settings, which result in finer details, will also increase the sweep time. During the capturing process, the ultrasound transducer performs a sweeping motion, capturing multiple 2D slices of the target anatomy. These slices are then compiled into a 3D volume. Ensuring that the sweep time is balanced between image quality and scan time is critical for obtaining an optimal 3D dataset. After the volume scan is captured, the next step is multiplanar navigation, which allows for detailed inspection and manipulation of the data. The volume data are displayed in a multiplanar view on the ultrasound monitor. This view presents the three key imaging planes: transverse, sagittal, and coronal. These planes are perpendicular to each other, providing a comprehensive view of the anatomy from different perspectives. In addition to these planes, the 3D reconstruction is displayed on the screen, showing a full 3D representation of the region of interest. This enables the operator to assess the structure in 3 dimensions and make further adjustments as needed. One of the key advantages of multiplanar navigation is the flexibility it provides. The operator can select any point on the reference image, allowing them to rotate the volume and adjust the orientation of the scan planes. This capability enables the operator to optimize the rendered image and better visualize structures from different angles. Whether adjusting for optimal visualization of a fetal organ or assessing complex anatomical features, multiplanar navigation is a crucial tool in 3D and 4D imaging. After the volume data is captured and displayed in the multiplanar view, the 3D image can be further manipulated using rotation and translation techniques. Rotation allows the sonographer to rotate the 3D image around all 3 axes X, Y, and Z. In addition to rotation, translation allows for the displacement of the center of rotation of the 3D reconstructed image. This means that the operator can shift the focal point of the 3D model, and the orthogonal planes, transverse, sagittal, and coronal, will be simultaneously updated to reflect this change. Translation is useful for refining the position of the scan volume and enhancing the visualization of specific anatomical areas. An important aspect to consider during rotation and translation is the threshold value. This value determines which signals are included in the 3D reconstruction based on their echogenicity. Optimizing the threshold helps to eliminate noise and artifacts, ensuring the highest possible image quality. Sometimes, overlying structures, such as the umbilical cord, placenta, or fetal limbs, can obscure the region of interest in the 3D image. This can make it difficult to accurately assess the target anatomy. The electronic scalpel software option provides a solution for this issue. With the electronic scalpel, the operator can remove overlying structures that interfere with the view of the ROI. This is particularly useful when certain structures, such as the placenta or other fetal parts, block access to the target organ. By removing these obstructions, the operator can focus solely on the region of interest, improving the clarity and diagnostic value of the 3D image. Once the volume has been captured and the image is optimized, the operator can select from a variety of rendering algorithms to visualize the region of interest in the most effective way. These algorithms are crucial for enhancing different anatomical structures and improving image clarity. The operator has the flexibility to choose between different rendering modalities, including surface, transparent, and light modes. Each of these rendering options highlights specific features of the scan volume, making it easier to assess the anatomical structures of interest. Again, surface rendering is a mode that emphasizes the outer surface of the ROI, making it ideal for visualizing the contours and shapes of external anatomical features. Transparent rendering allows the internal structures to be visualized while maintaining transparency in the surrounding tissues, making it useful for assessing internal anatomy and spatial relationships. Light rendering modality simulates the effect of light and shadow, enhancing depth perception and highlighting surface and internal details based on the lighting angle. By choosing the appropriate rendering modality, the sonographer can ensure that the 3D image effectively demonstrates the features of interest, whether focusing on surface anomalies, internal structures, or overall anatomy. Training sonographers to perform 3D and 4D ultrasound imaging involves more than just operating the machine. It requires understanding the technical aspects that ensure high-quality imaging. Sonographers must be proficient in the standard acquisition of volumes that will be displayed with minimal artifact. This involves understanding how to position the transducer, adjust imaging settings, and maintain optimal focus during scanning. A key component of training is helping sonographers recognize inadequate volumes. If volumes are affected by motion or other artifacts, they cannot be used for diagnostic purposes. Sonographers must be able to identify these issues during the scan and know how to reacquire the volume to ensure the best possible image quality. Training physicians who will be reviewing the volumes is also essential. Physicians must be taught how to evaluate anatomy from orientations different from the original acquisition plane. Unlike 2D imaging, 3D ultrasound allows for viewing structures in a variety of planes, and physicians need to be trained in how to interpret these views to make accurate diagnoses. Furthermore, physicians must learn the technique of scanning in 3D, as it differs significantly from traditional 2D scanning. They must become familiar with an entirely new set of controls and the specific nuances of working with volumetric data. The training process ensures that physicians are confident in analyzing the 3D data and extracting valuable diagnostic information from it. Although 3D and 4D imaging techniques allow for visualization of anatomy in planes that are not obtainable with conventional 2D imaging, the basic quality of the 3D image is still entirely dependent on the quality of the 2D information from which it is derived. Proper 2D scanning techniques and high-quality base images are essential to achieving accurate and reliable 3D reconstructions. Thank you for your attention and dedication to learning about the advanced techniques in 3D and 4D ultrasound imaging. Mastering these technologies is essential for providing high-quality diagnostic images, and the skills you develop will greatly enhance your ability to assess fetal anatomy and detect anomalies. We appreciate your commitment to improving your practice, whether you are a sonographer acquiring the volumes or a physician reviewing the data. Together, your expertise ensures that the benefits of these advanced imaging techniques are fully realized in clinical practice. We encourage you to continue exploring, practicing, and refining your skills with 3D and 4D ultrasound, as these tools have the power to transform patient care and improve diagnostic accuracy.